In the wild, survival demands absolute physical perfection. Predators look for the slowest animal, and rivals target the weakest. To survive this brutal reality, animals developed a powerful defense mechanism. They learned to completely hide their physical pain. Your dog might sleep on a memory foam bed and eat scheduled meals, but that ancient biology is still active in their brain. When something hurts, their deepest instinct tells them to act normal and suppress the weakness at all costs. This creates a dangerous blind spot for modern owners. Because dogs won't communicate their discomfort with obvious cries, we often dismiss slight behavioral changes. While you might assume your dog is just having a slow day, they could be actively, silently suffering. They tell us they are hurting through tiny, easy-to-miss signals. Today, we are breaking down 7 specific, highly dangerous signs that your dog is in hidden pain and requires immediate medical intervention. Some of these shits are so quiet they are nearly invisible, but missing them has severe consequences. Failing to recognize the #1 sign on our list leaves you with only a few short hours to save your dog's life. We start with number 7, isolation. Dogs are highly social animals that rely on your presence. When a dog that normally follows you suddenly disappears under a bed or into a dark closet, they're executing a defensive survival maneuver. You will see their personality fade. They stop bringing toys and lose interest in walks. This is a direct symptom of the exhaustion and vulnerability caused by pain. Number 6 is excessive licking. While normal grooming is expected, obsessive, repetitive licking, focused entirely on one specific spot, especially where there's no visible injury, is a major warning. Under the surface, the dog is attempting to soothe deep joint pain. The inflamed joint triggers a nerve signal. Licking degrades the skin barrier, sending new pain signals back to the joint, creating an escalating cycle of discomfort. Number 5, abnormal panting. Panting is a standard cooling mechanism, but doing it while resting in a cool room is a physiological red flag. Pain puts severe stress on the body, forcing faster, heavier breathing. Listen for the specific sounds that punctuate this stress. You might hear a quiet whine, a sudden yelp, or a desperate bark if you touch a specific area of their body. These behavioral regressions and physical tics are desperate attempts to self-soothe. They are managing invisible internal trauma when they hide, lick, or pant in the dark. Number 4 is strange posture. A dog will physically adjust its body to relieve pressure. Hunching, holding a rigidly arched spine, or standing stiffly often signals severe abdominal distress. Within this category is a critical, immediate warning: head pressing. If your dog stands entirely rigid and presses their forehead firmly against a solid surface without moving, you're looking at an absolute emergency. This posture indicates severe neurological damage, toxic poisoning, or brain inflammation. It requires zero hesitation. Do not wait. Head straight to the veterinary emergency room. Number 3, changes in gum color. A healthy dog has bubblegum pink gums. Press a finger against them. They should turn pale and quickly return to pink. If the color is off, consult this diagnostic chart. White gums indicate blood loss. Blue points to oxygen deprivation. Bright red warns of toxicity. These abnormal colors mean the dog's cardiovascular system is already under extreme stress. Number 2, sudden loss of appetite. A dog ignoring high-value food or refusing their favorite treat indicates a systemic digestive shutdown or organ infection. This level of disinterest points to significant physical discomfort. When your dog contorts their posture, changes coloration, or completely shuts down their appetite, the internal pain has officially overpowered their biological ability to hide it. That brings us to number 1. This is the most critical emergency you can face, and it requires split-second recognition: gastric dilation and volvulus, commonly known as bloat. Bloat happens when the stomach rapidly fills with gas and violently twists on its axis. Rotating 180 degrees visibly pinches off blood vessels, halting circulation. Blood flow is instantly severed, toxins become trapped, and surrounding organs rapidly begin to fail. The physical symptoms are undeniable. Your dog will attempt to vomit, but nothing will come out except foam or air. This is called unproductive retching. At the same time, their abdomen becomes tight, swollen, and rock hard to the touch. This physical swelling is accompanied by intense behavioral panic. They'll pace relentlessly, unable to settle down, standing hunched over, tail tucked, and panting heavily. Once you see unproductive retching paired with a hard abdomen, a terrifying timeline begins. You have a maximum window of 1 to 2 hours to get them into emergency surgery. Without an immediate operation, this condition is completely fatal. Dogs do not have the words to tell us when they are hurting, but they are constantly communicating their physical state every single day through their energy, their habits, and their subtle body language. You can read these signals by paying strict attention to the micro shifts in their daily routine. Notice when they hesitate, when they isolate themselves, and when a seemingly small change in behavior indicates a larger physical problem. Recognizing these 7 signs allows you to intervene before a condition becomes fatal. By watching closely for these specific signals, you ensure your best friend never has to suffer in silence.
If this video helped you, share it with another dog owner. You never know who might need this information right now. And if you want to become the kind of owner who truly understands their dog on a deeper level, make sure you like this video and subscribe, because your dog depends on you, and they deserve someone who knows when something isn't right.